This is a chronic condition. I'll have it for the rest of my life, they tell me. So I'm now just learning about it, and recently it came to my attention that the treatments to help with the swelling and the massages and the wrappings, they're not covered by Manitoba Health. So this is just a condition that was caused by cancer. It's not something I could have prevented in any way. Since I've developed lymphedema, my leg is 2 or 3 times the size of my other leg, and so it affects me every day in everything I do. I wear daytime compression garments all day long, and then at night I have a night garment I switch to. So I just want it out there that financially I'm lucky enough that I have a benefits package, but there's people who don't. Funding needs to be in place for people who can't afford these expensive garments, because without them, your lymphedema symptoms are much worse.
There's a great cost to having lymphedema. Just with the sleeves, I tend to replace them 3 to 4 months just because I'm active and working every day, so I'm wearing it all the time and it gets well used. The night garment sleeve is quite costly as well, but thankfully that lasts about 2 years. It's not covered through the government. It's something that you cover out of your pocket. So I have private insurance and it covers 80%. So I'm one of the luckier ones. But also that does make me scared for when my husband retires. You know, how am I going to cover the costs of the garments for sure?
You have to get treatments, and that is expensive because it's not covered. But being the 4th cancer with all my medication, that's where my pension and all the money goes. I had radiation for the last one. My cancer was in the mouth. Like I say, I have trouble eating, but I wear the mask. It's right over. That's why my hair is so short, because it's right over my face and it covers the lymph nodes. That again is not a very comfortable thing to have, but you've got to do it. You've got to do it.
I'm very fortunate in a very lucky kind of way. I happened to just get a job, and the job came with medical benefits. So when I asked if custom garments would be covered, they said yes. I can't imagine people who don't have a medical plan or supplemental health, whatever term you want to use. I don't know how people can cope with something like that. Almost $300 a pair of stockings that you go through, you know, every 2 months or so is a big hit, after-tax dollar hit.
Once you wear these things, I feel better. They've changed my life. You know, if I didn't have these stockings, I don't know what I'd do. I've had people help me. I've had friends of mine raise money for me, do a fundraiser to help me raise money to get a night stocking. You know, I need $1,500, you know, and they did a fundraiser for me to help me out because it just adds up.
The biggest thing for people with this condition is there is no provincial healthcare coverage, and I'm hoping that through the association that we're able to bring this to the forefront in the province and be able to get coverage for their compression garments. It would save hospital stays if they can just address the condition at the forefront rather than when somebody has to be hospitalized because they have an infection. It would just be all around better for everybody, for the healthcare providers and the patients and their quality of life.